for more on today's
Brought
stories.
to you by Shannon Medical Center and Shannon Clinic.
There are around 90 million people in the United States suffering from chronic pain. Unfortunately, a lot of patients are put on narcotics for the treatment of their pain and can eventually become dependent on them.
DRG is one way we have to try to treat chronic pain without the use of narcotics. The DRG, if you want to think about it in layman's term, is like the brain of the cell. It contains the sensory nerves that go to different parts of your body. So when we stimulate the DRG, we put a very small wire on top of the nerve. It sends small electrical impulses to the nerve, and it relieves the pain in about 80% of people.
DRG is best when treating localized focal pain. For instance, someone who has foot pain after an ankle fracture, or someone who has had hip surgery and has persistent hip pain. It is good at isolating specific parts of the body.
You have a trial period, so we identify the appropriate patient. Somebody has focal pain in a specific part of the body. Then we put electrodes in through through needles on top of the nerve. And then the person gets to try it out for about anywhere from 5 to 20 days and see if the pain is relieved significantly by this.
If a patient's pain is relieved by at least 80% during the trial period, then a permanent unit is put in place.
Well, the hope with the DRG is that you'll get off the narcotics. Now, you'll still have to use regular pain medications, Tylenol, ibuprofen, that kind of stuff, but we want to get you off the narcotics. And besides the benefit of that, a lot of people do have 80% relief of pain, and so they can increase their activity. They may be able to go back to work. Things that for a lot of people who have chronic pain, they're unable to do.
If you have questions regarding your pain and possible relief with DRG, please call Shannon Neurosurgery at 481-2193.